Hello and welcome to today's webinar with eLotus, your leading provider of acupuncture continuing education. My name is Donna Chow and I'll be hosting and moderating today's class. Today's webinar is Ethical Considerations for the Treatment of Trauma Survivors, presented by Elaine Duncan. Class will run from 11 a.m. to 1 p.m. Pacific Time. And now for the important details about the chat room, questions for the instructor, and your CEU quiz. For the chat room, please set your chat to everyone so that everyone can be part of the conversation. And next, for questions for Elaine, please type your questions directly into the Q&A box so that she can answer and see them and we can keep everything organized. And finally, your CEU quiz. Your quiz will be ready for you tomorrow and I will send an email out when it's ready. Our speaker today is Elaine Duncan, who is an acupuncture clinician, educator, and researcher. Her work integrates the wisdom of Chinese medicine with the study of neurobiology and traumatic stress in the classroom and the treatment room. This passion has carried her heart and hands to places and people she never imagined when she graduated from acupuncture school in 1990 and completed somatic experience training in 2007. It is such an honor to have her join us today. Elaine, will you please take over and share your screen?
Thank you very much, Donna. A generous invitation, introduction. I'll just add that I use the pronouns she and her, and I encourage you to name your pronouns if you feel comfortable or if that feels right to you, and that I'm speaking from the ancient land of the Anacostan people. I live not far from the Anacostia River in what is now known as Prince George's County and Mary's Land. So you can kind of hear the impulse of the colonial settlers that took that land so many years ago, but want to honor the land where I'm standing. So I'm going to go ahead and share my screen, give you a little bit of an orientation to our day together, our couple hours together. We're going to start with kind of a background on ethics, and then we'll go into just an overview, a thumbnail of trauma physiology that will give you a foundation for why these ethical considerations are so important and how they need to be thoughtfully considered for trauma survivors. That'll include an overview of Polyvagal Theory, the self-protective response, neurobiology of the 5 steps of self-protection that are mirrored in the 5 elements of Chinese medicine. And then we'll go into the ethical principles that are so critically important in working with this population. And I welcome questions, I welcome your thoughts, and I'd love to make this as interactive as we possibly can, given the limitations of a webinar, but it's so important for us to be in conversation, in dialogue with each other. So I really encourage that. And here is my contact information and my website. So if you have questions or an interest in contacting me in the future, please note that down so that you can find me. Okay. So there are many principles of the ethics of working with trauma survivors. Respecting rights and dignity, dissociation and shame, moral injury, informed consent, which is different than the piece of paper that you have your client sign when they first come to see you. And then this whole list of ethical principles that are defined by our licensing boards, but we need to look at them just a little more thoughtfully, a little more completely in the context of trauma survivors. So there are always unique choice points at every aspect of our professional code of ethics. So we're going to be looking at the principles of how we make decisions when faced with a challenging circumstance. And if we've thought about it ahead of time, it'll be much easier for us to be thoughtful when something acute comes up. So we're looking to guide the choices that we make so that they're morally appropriate and do no harm. How we treat trauma survivors is probably at least as important as the points we choose. Complex trauma creates unique ethical considerations and patient management choices. I think that the study of ethics in trauma survivors is largely about patient management. So understanding that trauma will help you find that pause between stimulus and response that supports ethical consideration. Always critically important, and interestingly enough, the social work board, the Board of Social Workers, has just added self-care to their code of ethics. And I really want to endorse your own self-care, because the more regulated you are, the less reactive you'll be in the face of strong feelings or strong emotions that may come up. So I often say that our most important tool that we bring into the treatment room is our own inner regulation, because that inner regulation, the heart math people teach us that it travels 6 or 8 feet away from us and influences the people all around us. So when we treat someone and they leave our office in a more regulated state, if they have a sleeping partner that lays next to them for 6 or 8 hours at night, they'll actually get treated too. So this is the nature of trauma as vibrational illness and acupuncture as vibrational medicine. So our own vibration is really important to pay attention to. So here's a image, and I want you to think of it as, we're going to think of these 2 parallel lines as our zone of resiliency. And within that zone of resiliency, there's a wave, an up and down wave. Looks pretty familiar to your first year of acupuncture school, where there's a rise and fall. And it stays within this kind of thermostat that is the zone of resiliency. Now, that zone, we could call it yin and yang, or we could call it sympathetic arousal. We could call yang sympathetic arousal and yin parasympathetic restoration. So those 2 terms actually mirror, like Chinese medicine and neurophysiology really mirror each other, because they're both based in regulation or dysregulation of the energy body. So we've got an awake and alert form of qi, and we have a rest and digest form of qi. And it's all right there. Our medicine speaks the language of neurophysiology. So when we have a trauma, when there's a lightning bolt that comes into our lives, say we're cleaning out the gutters at our house, and we're up on a tall ladder, and the ladder starts to shake because we reached too far. Now, if we're formerly a high school gymnast, then our zone of resiliency in the domain or in the sphere of balance and proprioception and strength is going to be pretty strong. So although we'll go into pretty high arousal in order to maintain our balance and not fall off the ladder, we'll also be able to return to regulation more readily. However, if we're not a high school gymnast, we'll do our best to stay upright, but more than likely, we're going to collapse down. We're going to end up on the ground and maybe with a broken scapula or a broken clavicle or something like that. And we may stay there for a long time. We may stay on the ground for a long time. It's a weekday, no one else is home. No one hears our screaming. That screaming is our sympathetic arousal. But if no one hears it, then our heart is called into this really high activation. And at a certain point, it can no longer manage that level of activation. And so we dissociate, we collapse, we freeze. And if we're met when our neighbor comes home with kindness, with not too much agitation, with nice slowed down thinking and some really healthy boundary touch, and call the rescue people, and they come and they're not too volatile, they take care of us, they're gentle, they're kind, then we're more than likely to return to our zone of resiliency, where our qi is available to help us heal the broken clavicle, the broken scapula, whatever happened. So that's danger. Danger includes activation and deactivation, and it always, recovery from danger always includes kindness and regulation. However, if our zone of resiliency is a little bit narrow, so narrow that the wave that's in the middle actually extends outside our zone, so that maybe we run up a flight of stairs and our heart starts to beat fast and we think we should have a panic attack because we're outside our zone of resiliency. Or maybe it's nighttime and we should be asleep. We should be in the yin time, but because it's outside our zone, we're wakeful in the night. So this is the nature of complex trauma where the zone of resiliency is narrow. So when that lightning bolt comes, so for example, maybe we're hiking in the mountains and there's a rock slide and the rocks land on our legs. And first we'll use every iota of chi that we have in our sympathetic system to push the rock off, pull our leg out. But it's too big and we're too small. So again, at that point where the heart is beating so darn fast that it can no longer maintain cardiac health, we're going to collapse. We're going to go into a freeze state. And we're going to stay there until some hale and hardy hikers come along and carry us off. Now, that freeze state is a helpful state because on the one hand, we're not going to feel as much pain. We're not going to be moving. And that saber-toothed tiger in the bush is really rather attracted to movement. So if we're not moving, we're less appealing to the saber-toothed tiger. And we also are preserving our chi. We're preserving our chi so that when those burly hikers come along to carry us out, we have a little more resiliency in order to recover. Now, the duration of time that we were in this freeze state and this hyperarousal state meant that our energy body went into this highly dysregulated state where there's both very high arousal and very strong collapse going on at the same time. It's kind of like brakes and gas at the same time. And each one of these pings here are probably another symptom. So one might be migraine headaches, one might be autoimmune illness, one might be irritable bowel syndrome, one might be obesity, one might be insomnia. Like people are going to have a lot of stuff going on. And because our training tends to be focused on how to fix problems, we may choose to treat one of these pings. But I'm going to assert that what's most helpful for this person is that we restore their core regulation, that we don't get lost in the discrete symptoms, but instead look for their essential regulation. Because until that essential regulation is restored, they're just going to create another symptom. So notice that this essential regulation remains underneath this high dysregulation. So we can count on that all of the fundamental expressions of yin and yang, sunrise, sunset, moon wax, moon wane, all of those things cannot be broken by anything that one human being does to another. So it's always available. And our job primarily is to help people find their way to their own core essential regulation. And the sooner we help them get to their regulation, the better, because when another threat happens, another overwhelming experience, they're going to go into that experience with less capacity to manage it. So repeated dynamics of threat, which I actually call traumatic stress. I call it too much, too fast, without adequate support. I think of it as the trauma spectrum response. It's a normal response to an abnormal situation. It's not a disorder, and it's not a permanent condition. So we want to help people know that this possibility of returning to regulation is always available to them, and we can help them because our core philosophical stance is balance between opposing poles of energy, which is essentially the problem with traumatic stress. Okay. So when we have complex multi-symptom illness, we've got a massive mobilization response. We've got really high tone in the sympathetic nervous system. And we also have a massive immobilization response. We have really high tone in the parasympathetic, or what in polyvagal theory is called the dorsal vagal collapse. So this duality of two states creates a cattywampus situation inside our patient's energy body. So there's massive dysregulation, massive disruption to the co-regulating functions of yin and yang. Yang has overwhelmed yin. Yin can't cool, slow, or settle yang. Yin overwhelms yang. Yang is unable to warm, mobilize, or activate yin. So I'm going to give you just a thumbnail of polyvagal theory. This is Stephen Porges. He's a wonderful man, and he's probably done more to help develop innovative approaches, particularly to trauma experienced as children, than any other person. So the traditional concept of co-regulation by two opposing neural platforms, it works to describe danger, but what it fails to describe is life threat, prolonged sympathetic activation, and developmental trauma. So when we feel life threat, we're in that dual state of high sympathetic and high parasympathetic at the same time. So yin and yang aren't regulating each other. Also, when we're in prolonged sympathetic activation, we're like, sympathetic is essentially our wood element. We're like angry all the time, and we can't survive in our tribe. We can't survive as a member of our community if we're only in sympathetic activation. We actually need to have a capacity for social engagement because the sympathetic system has no social intelligence. So in order for us to make use of our tribe to help us manage experiences of threat, we need to have some parasympathetic, some ventral vagus. And it also, the traditional method also doesn't describe developmental trauma, because when we're born, we don't have the capacity to mitigate arousal on our own. We need our caregiver to do that for us. So polyvagal theory describes the development of our capacity for social engagement over time, over the first 20 years of our life. So So the dorsal vagus, polyvagal theory says that there's 3 branches, not 2 branches of the nervous system. So the oldest one is the dorsal vagus, or the ancient vagus. It governs the water and the earth elements, and in our language, we call it yuan qi. At low tone, it supports passive movement of nutrients and waste across the cell wall, basically digestion. It innervates below the diaphragm and helps us digest and assimilate and make use of all the regulatory and visible functions of basically of the spleen. It's shared with all the ancient one-celled animals and also diving mammals and all vertebrates. So diving mammals like a whale can hold its breath for a very long time underwater. And that's its function of its dorsal vagus is very strong to be able to allow it to go into a neurologic state that doesn't require as much oxygen. So the low tone dorsal vagus doesn't only influence our capacity to mitigate threat, it also influences how we digest information, how we digest experiences, how we digest thoughts. So we can think of it as our belly brain, the home of our gut biome, and it has a profound influence, that belly brain, that gut biome has a profound influence on production of neurotransmitters like serotonin and dopamine, and also T cells. So our immune function and our mental health is critically important for us to pay attention to the gut, and certainly gives rise to understanding why trauma survivors can have so many symptoms in the realm of anxiety, depression, mental health kinds of things, as well as autoimmune illness and other kinds of immune functions. So the gut's critical for our awareness of safety. Like, I knew I could trust him. I knew in my guts I could trust him. I knew in my guts I couldn't trust him. All that information comes from the gut biome. But the dorsal vagus will not mitigate sympathetic arousal. Low tone dorsal vagus will not mitigate sympathetic arousal. We need high tone dorsal vagus in order to mitigate sympathetic arousal. So again, this low tone dorsal vagus is available when we're passive, like staring at the sky on a summer afternoon, laying on the grass. It innervates all of the food, the organs below the below the diaphragm, the organs that process and move impure substances. So when you think about it, if the fu are disturbed, then our capacity to process and move impure substances and impure experiences like traumatic stress gets really compromised. So paying attention to the regulation of the fu is really important for trauma survivors. In an invisible way, it turns last night's gristle into this morning's poop. So it helps us with information about safety in our guts. It's completely functional and completely unconscious. It can't be willed, which is really helpful for our patients because we can attend to the function of the gut biome with our treatments and with our needles and also with touch that can help restore its regulation without them having to will it into being or tell their story. Really critically important. So high tone dorsal vagus, that's the clumsy break. That's the help me freeze when things are overwhelming. Help me collapse when there's too much energy coming in and I need to just kind of go away because it's too much. So high tone dorsal vagus is essentially the water element, has a big influence on the earth element. It orchestrates the freeze response. So it mobilizes the water to overwhelm the fire. And the fire, the heart, is essentially what Stephen Porges calls the ventral vagus. It's the function of the Shen, what we call the Shen. So when the water overwhelms the heart, the water will overwhelm our capacity for relationship, which is in the ventral vagus. And of course, it's very risky if we become habituated to using it, or if we use it too frequently, because mucking with our cardiac function is risky. So we don't want to use it too much. And when someone is in a freeze state in our treatment room, we don't want to take them out too quickly because that freeze state is always connected to a hyperarousal state. If we take them out too quickly, they'll go into rage, they'll go into overwhelm, they'll go into places that are challenging to remember, challenging to function. They may feel shame. It's unnecessary. So go slowly when someone's in a freeze state. Honor it as a management strategy that was critically important, and allow them to stay there, coming out in bits and pieces.